Thank you for joining this video. We're here to talk about children and COVID-19, and I'm going to ask our pediatrician, Dr. Verlander, to introduce himself.
Hi there. My name's Sean Verlander. I'm one of the pediatricians out in the Valley Medical Center Covington Primary Care Clinic. It's a pleasure to be here today, and let's get started.
Great. So when the news was reporting on the coronavirus when it was happening in China, we heard that it was affecting adults, but not really so much with children. But now we're aware that it can also affect children. What do we know about the risk for kids to get COVID-19?
Well, we know that this is a highly contagious virus, and early information was that kids weren't getting sick, and unfortunately that's not necessarily true. What can be said is that based on the data that we have available, less kids are testing positive. According to the CDC's statistics, less than 2% of lab-confirmed cases come from kids under the age of 18. That doesn't mean that kids aren't getting sick, but we do think that there may be a lower risk of having severe respiratory symptoms in kids under the age of 18 compared to immunocompromised folks or elderly populations over the age of 60. But lower risk does not mean zero risk.
Okay. And so we all should know about the common signs and symptoms such as fever and cough, but can you talk a little bit more about some of the symptoms that are specific to kids or that we've seen more prevalence in kids?
Well, I'd like to answer that kind of in an opposite way. They tend to have a lower likelihood of having things like fevers, coughs, and shortness of breath. So it may be a little bit more insidious in children. We're also noticing both here in the United States as well as abroad that there are some inflammatory conditions that may be caused by COVID-19. It seems like there may be some interaction between the immune system and COVID-19 that causes an inflammatory response. Something similar to like Kawasaki disease or toxic shock syndrome. So in addition to the respiratory symptoms, you may also see things like enlarged lymph nodes and rash, redness of the fingers or toes. You may notice a strawberry tongue, abdominal pain, vomiting, diarrhea. So there's a lot of other things that can cause or that can be show up as a result of the immune system kind of interacting and causing a hyperinflammatory response to the COVID-19 virus.
Okay, so if my child starts having any of these symptoms and I'm not sure if it's that they have like just regular cold or maybe they're having some allergies or some other things going on, should I call my provider no matter what, or should I just watch and wait?
I think it's always a good idea to touch base with your provider if you are concerned. In terms of testing guidelines, we are recommending testing for anybody with a cough or shortness of breath. And if there's a constellation of like fevers, headaches, sore throats, congestion, typical symptoms of a respiratory infection, then we're considering testing as well. For special populations like folks who don't have a normally functioning immune system, really any symptom of a respiratory infection would be an indication for testing. But it's never a bad idea to reach out to your provider's office and say, hey, here's what we got going on. What should we do about it? We get lots of calls about that, and we're happy to help, and we're happy to assist remotely when that's possible, when that's feasible.
Okay, great. So some parents might be concerned about bringing their kids in for a well child appointment, immunizations, or other types of illnesses. How would you guide parents along those lines?
Well, we are still recommending standard well visits. Number one, to make sure growth and development is staying on track, but also to keep up to date on things like vaccinations. We would hate to get to the point where we see outbreaks of vaccine preventable illnesses as a result of kids missing out on their recommended vaccines. So in order to help facilitate that, we're trying to make the clinics as low risk as possible. By that, we have a screening process in place where we're checking temperatures at the door and screening for any respiratory symptoms before anybody gets inside our clinic. Beyond that, we're trying to reduce the risk of transmitting infection from patient to patient by practicing social distancing, by taking a little bit of extra time to make sure that everything is sanitized properly in between patients. And we're also positioning things in the waiting room so that folks are not getting too close to one another. One thing that our clinic out here in Covington is doing that I think is pretty remarkable is we're starting to self-room, meaning that when patients get checked in, instead of going and sitting down in the waiting room, they're directed to the examination room that they're ultimately going to go to help reduce the amount of people that are in the waiting room to reduce the risk of infection. But it's very important to understand that just because COVID-19 is happening and that there's an ongoing pandemic doesn't mean that we need to ignore all preventive care and well checks.
Okay. And how about telehealth visits? Is that something that you can do for kids?
Yeah, we actually are doing telehealth visits, but it has to be something that's appropriate to telehealth. Adjusting medications or talking about mental health issues, evaluating a rash, all are things that we can do remotely. Following up on somebody's asthma, where I actually need to listen to somebody's lungs, or trying to get somebody caught up on vaccines through Zoom, just isn't feasible. So we are trying to take it on a case-by-case basis, but we are offering telehealth when we think it is appropriate.
Okay, great. So now with the stay-at-home orders and many kids spending more time in front of their screens, whether it's a phone, a tablet, TV, or even now that they're having to do online schooling, what are your recommendations for parents about how they might set limits and having their kids get some more physical activity?
Well, I think it's important to remember that while we want to do right by our kids and minimize the amount of screen time that they have, ultimately, with reality being what it is, kids are probably going to be having more screen time in place. Now that said, there are ways that we can try to adapt that in a healthy manner. One would be to try to compartmentalize, meaning that you try to leave your schoolwork for your school device, and then TV and screen time otherwise is on your more personal device. If you don't have one for home, one for school, you can try to utilize the parental controls on these devices. Set a timer saying no more than 2 hours of entertainment screen time per day. How to access those parental controls are different on each and every device, but it is something that's worth looking into at home. I also recommend taking physical activity breaks. The way that we would do that would be to set a timer or an alarm, and when that goes off, to kind of unplug from the screen and go for a walk, or do something that's physically active to get a little bit sweaty and breathing hard to maintain physical activity. Other things to think about, really, one of the ways that you can get outside is just try to be creative. With younger kids, it's fairly simple. You can do things like scavenger hunts out in nature. You can get out in the dirt and play in mud. Most kids like to play in dirt or mud, and that's okay. You wash them off after you're done playing out there, and you have some fun. Older kids and teenagers, if they're more sports oriented, if you're using equipment that's not shared with any other households, you could do things like play catch or kick a soccer ball around, or ride bikes. Something to get some fresh air in those lungs and to stay physically active as a family is definitely something that we want to try to emphasize, even with the stay-at-home orders in place.
Okay, let's talk about masks. So if you go outside with your kids or take a walk as a family or even go somewhere in public, what are the rules for kids wearing masks? And what is the youngest age that a kid should wear a mask?
Well, if you're going to be outside and you can maintain social distancing, there really isn't much of a need to wear a mask there. Now, if you're going to be indoors in like a grocery store where you can't maintain social distancing, then we do recommend kids over the age of 2 wear a mask, and ways that you can help normalize this for them would be to wear a mask yourself, have kids look at themselves in the mirror with the mask on, try to explain that the mask is to help prevent people from getting germs and getting sick. But yeah, that's where we draw the line, is 2 years and over. And you want to make sure that it's not a choking hazard. If your kid is wearing a mask and they're breathing heavy, or they don't sound normal, get the mask off them and make sure that that it's not blocking their airway in any significant way.
For kids who are having a more difficult time emotionally during this pandemic, whether it's the abrupt change with not going to school or seeing friends, or having anxiety about what is on the news, what guidance do you have for how parents can help support their kids through this time?
I think that it's important to talk with your kids, not only about what's going on during the day, but also how they're feeling about it. Asking open-ended questions, and then also emphasizing that it's okay to feel stressed out or anxious, that this is something that is not normal, and it's okay to have mixed feelings about it. That way you can validate the way that they're feeling, and they can feel safe in terms of talking about it. I think it's also important to utilize the things that are a part of our normal day-to-day life. Even before the pandemic happened, I always stressed to families that having dinner together is less about eating your food and more about talking with each other about how they're feeling and how their day went. Studies have shown that rates of anxiety and depression amongst families who regularly eat meals together are lower. So we know that talking with kids about how they're feeling is going to have a positive impact on their mental health. It's also important to remember that if parents are concerned for severe depression or suicide, that is something where they need to reach out and get some help, either from their primary care provider, or if somebody is actively suicidal, then they need to go to the emergency room, regardless of the risk of the ongoing pandemic.
Okay, great. Well, thank you for answering all the questions. Appreciate your time. And thank you to our viewing audience. For more information, you're welcome to go to our website at www.valleymed.org.